Welcome to M Squared TechCast.
And we have Fred Brown, who is our coronavirus expert. How you doing today?
I'm good, Mike. I'm good, Pat. How are you doing?
Good, thanks. Listen, since
well.
we had you on last time, basically all hell has broken loose.
Yeah, something, huh? It's we keep
and it's gonna get worse.
yes.
Yeah,
Well, that's what I wanted to talk to you about. Fred is, gosh, you've such a very strong healthcare medical device background. I believe you're on the Johns Hopkins board of directors as well. I mean, you've got a tremendous amount of knowledge. And that seems to be the issue right now. We have a tremendous amount of, I don't know, fake news. I'm trying to be kind here. No one really knows what's going on. I'm not saying that you know exactly what's going on, but maybe you can help us figure out what needs to be done moving forward.
Yeah, is it testing? Where are we falling short right now?
Well, if you think about there are two kind of big areas. The first area is in healthcare, and the second area is in the economy. So if we take the healthcare area, basically we're going through three phases. The first phase is detection management. That kind of started on January 30th when we first confirmed the first case in the United States, and we first did that in Michigan March 10th. That moved to contact transmission management, and that's when the CDC issued a social distance policy on March 14th. And now we're more in community spread management, and that was first detected in Michigan on March 20th. So we're starting to get into another phase of the disease state, and each phase impacts the next. Unfortunately, right now, if you poll the United States, about 62%, over half of us think this is a lot of hype.
Yeah, amazing, huh?
The truth is, The truth is that our response is comparatively way too slow and way too small to be effective in the health area, and even worse in the economy area right now, unless we get our act together. So maybe we should go through some of those things in terms of detection. You mentioned detection. Basically, we should be testing over 1 million people every week in order to understand where the virus is, who's immune to it, even more importantly in many instances, because they've already had the disease and recovered from it without knowing it, or having a small cold, and being able to get people back to work more quickly. So without detection systems, I know the government's saying, well, we're going to ration those right now, and that's what they're doing. They're saying we don't have enough of them, and so we're rationing detection and testing. But instead, we should really be ramping up significantly our production of these tests and our expansion of the kinds of tests we're using. Right now, we're using PCR tests. That should move to an ELISA test based on antibodies, so you can actually see who's actually been exposed to the disease, not just who actively has it. So the fact that we're not using the military more effectively to actually come in, set up labs, run tests, produce more tests, is a failure on our part. Most countries are doing that. They're actually, we're seeing generals out in the front lines, commandeering buildings, telling the labs to do tests. We don't see that in the United States, and that's a mistake right now.
Yeah, I mean...
so that's the first area.
Yeah, I'm just amazed that we haven't activated the military. They have all this training. They have all these field hospitals. They have all these doctors, nurses, you name it, right?
Yeah, they should be out there testing. And in every public venue where you've got a significant number of people, like we saw that those people congregating in Daytona Beach or for the Cherry Blossom Festival, I mean, those should be cordoned off. Anyone who enters those kinds of venues should be tested for their temperature with a rapid temperature test. Anyone who has a temperature should be cordoned off and said, you go home now, and put into quarantine immediately. And the fact we're not doing that is going to really cause our response rate to slow and our death rate to increase compared to other countries. And that's a shame, because we do have a benefit in the United States. We're not as concentrated as a number of these countries, and we have a younger population than a lot of the countries in Europe especially. But because we're not responding to it quite as well as China did, I think we're ahead of UK and Italy, but behind in most other countries. We're gonna suffer on the detection side, and then of course we have to move to the contact transmission side, and there the biggest issue is that we're not enforcing the boundaries and getting everyone especially the healthcare workers, getting them their protective equipment. We've heard a lot about.
Yeah, what should we be doing with the protective equipment that we're not now? I mean, I hear a lot of companies offering to produce protective equipment, but it takes a while to ramp up to that, right? I mean, we didn't become the arsenal of democracy overnight either. So, yeah, I mean,
That's right. Yeah, yeah, you're right. But we do have to, use external volunteer, government, military support as much as we can in order to ramp up our production of this personal protective equipment. I mean, right now we're running so low that we're going to start transmitting. The healthcare workers are going to get very sick very rapidly, and probably at an 80% level, and then we won't be able to take care of people who are sick. Because we're trying to learn now the protocols for how to disinfect used materials. That should all be federal government. So, I mean, the FDA should basically stop all of its other testing and focus on this issue. They should be developing protocols for decontamination of used equipment to pull us through. Right now, it's catch as catch can. That's dangerous and basically too slow to be meaningful on a health system that's so diffuse in the United States right now. So we have to really get that protocol ramped up so we know how to disinfect, and then we have to get a lot more production up and running very, very rapidly. That means 24-hour shifts. It means supply chains. It means raw material handling. It means not just not just the area you're hearing about, which is the N95 mask, but it's also gloves and gowns and shields that are so desperately needed. And especially the U.S. at a federal level should be understanding where the outbreaks are occurring, so we're not supplying, San Diego when all the outbreak is occurring in San Francisco. We're going to have a very spiky demand function here, and it needs to be coordinated centrally. And I'm not seeing that yet by the U.S. government. FEMA is starting to get involved, which is great, but it really needs a much more coordinated dashboard-based response saying, here are our goals, here are the metrics that we're using, here are the actual numbers on a day-by-day basis of what's going on with infection rates, what's going on with hospitalization rates, what's going on with death rates. It can be, these. I like what President Trump is doing and trying to get out the message fast as possible. That needs to be a much more professional, much more fact-based approach to this whole piece. It should look like a very well run military machine or a production facility. I mean, like we would a business.
So, sounds like a job for industrial engineering, maybe. Yeah, I mean that's systems optimization and Six Sigma and all that good stuff.
Well, I know the auto industry wants to step in and do ventilators. I don't know how you can retool an auto plant to do ventilators because they're quite different, but I know that's been mentioned. And then also I know you don't want to get into politics necessarily, but we're waiting for the president to, I'm not sure, what's the proper term? It's like not the War Powers Act, but where he can.
That's what it's called, I think.
He can essentially militarize the industrial complex to do on a war footing. In this sense, it would be a war against the virus, right?
That's the Defense Production Act.
Thank you. I knew there was a name for it. Yeah.
But he keeps saying, well, people are volunteering. The problem is that the voluntary actions are not sufficient. I mean, we're not, we need to have more facilities. We need to have people running 24-hour-a-day shifts. Right now, Honeywell and 3M are at capacity. So that means, and those are doing most of the N95, that's most of our capability at N95 masks. But the other big issue is the supply chain generally. You're having bidding wars between states, and that has to change very rapidly, or you're going to, again, oversupply one area and undersupply the area that really needs it when the outbreak's occurring. So those are some of the things that the federal government needs to do fast.
Okay. So based on what we know now, how under capacity are we from a hospital standpoint? And what do we do about that?
Well, yeah. So every hospital in the United States should be requested immediately to increase their capacity by 100%. These plans should be implemented, starting to be deployed April 1st. I mean, that's how fast we have to move. And they should be taking over hotels that have been abandoned. They should be taking over, the convention centers. They should be able to say, if an outbreak occurs, here's our facility ready for taking on patients. Well, that should be every hospital in the United States. And that means increasing ICU capacity by 300%. There should be plans in place to at least try to do that. And every hospital in the United States have plans in place to increase their capacity by 100%. Because what we're seeing is that where the outbreaks occur, we're going to have at least a twofold excess demand to what we can actually supply.
Well, I was thinking also all these colleges have shut down. All these dorms are empty.
That's right.
We could use I mean, they're perfect
Yep.
for a hospital setting, right? For a dorm room and all that.
Yeah, and what's nice about this is if we then, say, well, we're done with that facility, we don't need it. You can decontaminate the facility simply by abandoning it for 5 days, and the virus will die. So you're not talking about a tremendous impact downstream of this. We're just having the plans in place to be able to do it, and I think that's important to do. Then we have the economic piece, and there we're also not responding as fast and as deeply as we should. Basically, we're going to see a threefold contraction here. First, there's going to be an economic slowdown, then there's going to be job loss, and that's already occurred in spades, and then there's going to be wealth losses in 12 to 18 months. And the economic slowdown, I think overall, will be about $3.3 trillion of slowdown. That's about 62% of the economy is going to contract. That's high. That's slightly higher than the Fed was estimating, about 50% this quarter. I think that the next quarter it will contract by another $1.3 trillion. By that point, the end of September, I think we'll be getting back to normal if we don't have a rebound of the virus. So we'll go through. The procedure, the process of the COVID progression will be we will have shutdown requirements because this virus is going to be so devastating through the mid to end of May. And then we'll start to see a slowdown in the transmission, and finally we'll be in control, in June, July. By August, I think we'll be in control again if there's no bounce back. And by September, we'll be able to travel and do things a lot more normally. So that's sort of the contraction levels that the economy is going to face over that work. There are some people saying, why don't we just wait 15 days and let everyone go back to work? I have faced those decisions in the past, working on the Ebola virus and other problems. And I can tell you that if you do that, things will get a lot worse very rapidly, and it'll cause an even worse overall impact. Even though it seems like it's a viable solution, when you're really faced with that decision, you find out that all you do is make the problem worse. So right now, the Congress is thinking about $1 to $2 billion and kind of 15-day segments. It needs to be 3 to 6 month segments of time intervals planned, and probably about I estimated about $4.3 trillion to enter the economy. Not $1 to $2 billion, 4.3 trillion.
That's pretty staggering. Yes.
Yeah, that's like a quarter of the GDP or something like that, I think.
Yeah, it is.
Yeah.
Yeah, and that's not quite the full impact. This full impact will be 5 to 6 trillion.
Yeah.
But at least what we're doing on the health side is, I want to see, at Daytona Beach, I want to see tanks on the beach. I want to see MASH tents on the beach. I want to see lots of kids, running around getting, self-controlling. So it should be a wartime kind of response. On the economic side, it actually should be a natural disaster type response. So a little bit different responses, but in both cases, we're not doing as much and as fast as we need to, which means that we're going to have more deaths and more economic lag than we really should be facing, which is disappointing.
Okay.
We still have time, but we need to act fast.
All right, Fred. Well, next time we have you on, I want to book you for 2 segments.
Yes.
Because we're out of time.
Yes, there's a lot to cover.
Okay.
Things are moving fast.
Yeah, I was going to say, because we're out of time, and I still got questions. I'm sure Mike does too. But thanks so much for being with us today. Healthcare consultant and
coronavirus expert.
Yeah, infectious disease expert who's worked on stuff like Ebola before. So
HIV,
he knows this
a few
stuff.
things like that.
Yeah,
right?
just a few things.
Yeah.
Fred Brown, thanks for being with us.
Additional 4-year students love Lawrence Technological University's thriving campus life. But LTU has always met non-traditional students' needs too. Lawrence Tech offers over 100 degree and certificate programs that can get adult students started or back on track. And most of our classes are conveniently offered evenings at our beautiful Southfield campus or online, so you can balance your social, family, and work life even while you power up your career. Lawrence Tech, where Blue Devils dare.